Hey everyone. This week we're talking about STEMI patients. Being an ER nurse, this is the type of patient that I see on a pretty regular basis. I do feel that my facility does actually a really good job with these type of patients, and I'll kind of go into that in just a few minutes. But to kind of start out, I want to talk about what our textbook says on page 139. It says that our heart is the hardest working organ in our body. It is constantly and continually working from the time that we're born to the time that we die. So a STEMI, or an ST-elevated myocardial infarction, is a condition in which an artery that supplies an area of the heart muscle with blood flow, and therefore the oxygen in the nutrients, becomes blocked or occluded. So this blockage prevents that area of the heart muscle from receiving what it needs to function. The phrase time as muscle very much applies to these patients because the longer that artery is blocked and the blood flow is blocked from getting to that part of the muscle, the more damage is being done due to the lack of oxygen and nutrients. So the muscles in your heart, and really any type of muscle, needs that oxygen to function and function properly. Our textbook does say that it can function, that the muscle cells can function anaerobically or without oxygen for a short period of time, but it's not able to sustain itself for long periods of time with that. It actually states in chapter 14 on page 240 that the myocytes, or the muscle cells, will begin to die in about 20 minutes unless the blood supply is quickly restored. So that statement right there perfectly illustrates why time as muscle is so important in STEMI patients. You're literally working against the clock to reduce and to minimize the amount of damage to the heart muscle because of the blockage. Our textbook also kind of goes into some of the other effects that can happen because of the lack of oxygen in the heart muscle, such as the lactic acid buildup, which can lead to acidosis in the body, and also a decreased contractility of the heart, so a decreased overall function or overall strength force of the heart, which can lead to heart failure. I found an article in the Journal of Emergency Nursing, and it's entitled Saving Muscle, Evidence-Based Strategies for Reducing Door-to-Balloon Times for ST Segment Elevation Myocardial Infarction Patients. So basically the whole point of this article is talking about how quickly can we get a patient up to a cardiac cath or a PCI, percutaneous coronary intervention. One of the paragraphs in here says that strategies to decrease DTBT, or door-to-balloon time, include decreasing time to EKG, reducing unnecessary consultations, empowering emergency physicians to initiate the catheterization team, streamlining the process for staff notification, decreasing delays in the physical transfer of patients from the emergency department to the catheterization laboratory, using paramedic training and knowledge to accurately diagnose and triage patients with STEMI, and using modern technology. And as I said before, I really feel like the facility that I work in does a very good job of using majority, if not all, of these strategies to decrease our door-to-balloon time. I have actually seen STEMI patients come in, if they're called a code STEMI prior to, if our EMS was dispatched, was able to do their own EKG, and they're calling it a STEMI based off of that. They can actually transfer their EKG to us at the hospital before the patient ever arrives. So our ED doctor and our cardiologist who responds to the code STEMI actually have a chance to look at the patient's EKG before the patient ever hits the door. There has many times, more often than not actually, that they decide to do a cath actually based on the EKG that EMS does. So we don't even do our own EKG when they hit the door. They are eyeballed by an ED doctor and by the cardiologist at the bedside, and they go straight upstairs. Most of the time on an EMS stretcher. We don't even transfer them to our hospital stretcher. There have been patients that I have seen that are code STEMIs that are in our department in the emergency room for less than a minute. They roll through the door, they eyeball, and they go. And that's really, honestly, the best thing for them, because the only thing that's going to fix the problem that they have is to restore the blood flow. And the best way to do that is to get them up to the cardiac cath. There's not a whole lot we can do in the ED for that. So, like I said, this is something that I feel really strongly about, and I feel really good about, and it's something that I feel that the area that I work in kind of allows me a lot of experience and stuff in. So I really enjoyed working on this week. Excited to see what y'all have to say.